Welcome back to Great Day. For active kids like Ariana, eyeglasses and contacts can get in the way of her busy life. Dr. Julio Arroyo from Eye Health Consultants has a way to improve our vision while we sleep. Dr. Arroyo, not all eye offices are the same. You strive to have the best technology.
We definitely try, and technology had actually taken us eye doctors a long way. In the past, we used to have this little device to see the back of the eye and try to guesstimate whether the patient was healthy or not. Now we have all these different technologies, scans that allow us to really have better information and of course tell the patient, look at them in the eye and say, well, I'm pretty confident your eyes are healthy or not. You see, this patient, if we just look at the wall or at the retina, we don't know what's going on because we don't see an elevation pattern. This particular patient, this is a 3D representation of the retina, and all of a sudden we realize this patient has inflammation of the macula. This is actually something that happens in different conditions like macular degeneration, diabetic disease of the eye, etc. But the point is that we can now go through the different layers of the retina to see where the damage is.
Yeah, all right. I wore glasses since 3rd grade, and back then the only option I had was to wear glasses or contact lenses, and both of them became bothersome because I was active in sports and I was in band, and glasses are always slipping down the whole bit. Kids today have another option called corneal molding. What has made the world of difference for her? Ariana, you have problems seeing distance-wise. What were you doing before to correct that vision?
I had glasses. I've had glasses since like kindergarten, maybe a little later. And it was really hard for me because I was really little, and it was just like, it was bothersome, you know, it was annoying, and they would slip off, you could easily break them, you could scratch them, and they're super expensive, so you'd have to replace them. Sometimes you'd have to replace the lenses, get like different prescriptions, and I really didn't like it at all.
Yeah. How were contacts a problem for you?
Well, things could easily get under them, and you would have to take them out, wash them, you'd have to replace them sometimes, get more, and those are expensive too. They were difficult to put on, difficult to take out. They were irritating, like if you wanted to scratch your eyes, they would come out, they could rip, and they could actually like scratch your eye and hurt it.
So you were finally fitted for corneal molding, and you sleep in those at nighttime. The first night you did it, you slept in them at night. The next day, what happened?
I could see perfectly, like without contacts, without glasses. It was really cool. Like I'd never been able to see with my eyes, so it was like amazing. I could see the world.
Another group where corneal molding is perfect are those of us who kind of turned the corner, that mid-age thing, and we're having trouble seeing close up, which will happen to most of us. So corneal molding is perfect for that. So you don't have to deal with the monovision contacts, or you don't have to deal with having glasses all over the house.
That is correct, and it's definitely becoming very popular for that group too. Imagine, Deborah, how you're blessed with perfect vision all your life. You hit 40, 45, and all of a sudden you go like, oh my gosh, I can't see anymore, right? Well, those patients hate glasses. They just hate them because they are not used to them. What are my glasses? They need them 20 times.
Well, and because you have to take them on and off. Like I was putting mine on to see close up, taking them off to see far away, putting them on to see close up, you know.
Correct. So this kind of gives you a way to recharge the batteries of your eyes while you sleep. So during the day, you don't have to wear glasses. You don't have to think about, oh, where are my glasses? I can read this. So yeah. You're completely free and pretty much no concerns or no anxiety about not finding the glasses to see up close. You can actually see with your naked eyes as well.
And I was shocked at how quickly it happened. Tiny writing, and then it didn't affect my distance vision, so it was perfect. The other thing that you deal with here, and we're hearing a lot more about when it comes to eye health, is dry eye. You have a treatment for dry eye.
Dry eye is becoming epidemic. That's another thing that we see all the time. What we have realized is that there are a growing number of patients that are losing the glands that control the moisture of the eye. We are able to now estimate how those glands are working, and we can actually unclog them or even reactivate and sort of resuscitate the ones that are not working so well. So in optimizing the way those lacrimal glands work, we're able to tell the patients, well, now you're going to have better moisture because those glands are working at an optimal level.
Yeah, so instead of using eye drops and medications, you're helping the body help itself and restore itself.
We need to improve the gland quality. We need to improve the nutrition so those glands work at peak performance, and we need to reduce the inflammation at the level of the surface of the eye so those tears can be more stable.
When it's all said and done, how many times a year should we come in and get our eyes checked? Because I think a lot of us show up when there's a big problem. We don't show up on our regular preventive basis.
We usually say that once a year is okay. Of course, if you have specific issues like glaucoma or macular degeneration, dry eye, things like that, it may be a couple of times, 3 times a year, depending on the situation.
All right, Dr. Arroyo, thank you very much for helping us to see how we can affect our eye health in the best possible way for our lifestyle.
Well, thank you very much, Deborah. It's great having you here.
Eye Health Consultants has a special offer for Great Day viewers. Get $300 off corneal molding when you mention Great Day Houston. But you must be one of the first 25 callers. Call them now at 281-419-3355, 281-419-3355. And for more information on corneal molding, log on to sleepnc.com.